Hello, Dr. Eugene Aiello here, another video in my series of patient education. Today we are going to be talking about inflammation, more related to how it affects chronic pain. So to understand inflammation, we have to start right from the get-go. Inflammation is going to be created from tissue damage. That tissue damage could be thermal, mechanical, or chemical. I think that speaks for itself. I'm not going to get too deep in that. But when cells get damaged, so the functional unit of the body is a cell, so that thermal, mechanical, or chemical damage is going to affect the cell. The cell is going to be injured or completely destroyed. What that's going to do is release a lot of debris. Debris could be categorized as any cellular content, any free radicals. As I've spoken about in other videos, the oxidative stress video, biologic tissues are very specifically created, constructed, arranged that they control electrons within them. Electron flow within biologic tissue is very important. When you damage a biologic tissue, you start creating a lot of free radicals, biologic molecules that are no longer stable. They're either wanting to pull electrons from other things or they're wanting to give their electrons away. So these free radicals, this debris, is not something that this tissue, this environment wants around it. So every cell will have receptors on it. Those receptors can sense when there's massive amount of free radicals or cellular debris in the area, that receptor is going to be triggered. Arachidonic acid, which is an omega-6 fatty acid that we consume in our diet. We cannot make the arachidonic acid in our body. We actually have to consume it. It's nutritionally derived. That arachidonic acid is normally within those cell membranes. That arachidonic acid adds fluidity to the membranes. It allows those membranes to move things in either direction from the membrane. So arachidonic acid will get released into the cell when that signal is perceived, that debris is perceived. This is not good. Arachidonic acid at high levels within a cell could actually destroy the cell. So once that arachidonic acid is released, there's an enzyme called cyclooxygenase, COX enzyme. That COX enzyme is going to convert that arachidonic acid into prostaglandins. Think of prostaglandins as being the way the cell is saying, uh-oh, somebody around us is in trouble. So that cell that perceives that debris is now telling the other nearby cells something's going on. It's going to activate the system that we call inflammation. It's going to start the process. So those prostaglandins, and I'm not going to get too muddy on this, those prostaglandins then get transformed into different types of prostaglandins. Conventional science is studying this quite a bit because they love to intervene. They think they can stop this process in very precise ways by using chemicals that are going to inhibit enzymes that create the reactions. That's where things will get kind of ugly. NSAIDs, ibuprofen, acetaminophen even, these are working by inhibiting that COX enzyme from transforming that arachidonic acid. So common sense tells you right now with what I told you, arachidonic acid in the cell is not a good thing. It's toxic to the cell. So right off the get-go, taking an NSAID is going to elevate this arachidonic acid. We'll get back to that. So these prostaglandins all have different functions, the ones that are made. We're going to get a prostaglandin that first is going to induce platelets to clot. Okay? That's common sense. If there's any tissue damage, we want to make sure that there's no leakage of blood. So we're going to clot up those little capillaries and small blood vessels in the area. The prostaglandins are going to make those capillaries more permeable. They want to let things out. They're going to open up their openings so white blood cells can migrate to the area. They also want to let water and fluid out to the area. That's going to dilute whatever's going on with this debris. Vasodilation, those larger blood vessels that feed to those capillaries are going to open up. We're going to bring more blood volume to that area. Again, we're bringing in white blood cells, we're diluting the area. Those prostaglandins will also tell white blood cells something's wrong here. So white blood cells will be attracted from the bloodstream into that area, so they exit those leaky capillaries to get to where they need to do their job. So I call this step one. Dilute and hemostasis. So we're going to basically dilute the area, get that debris less concentrated in the area, and we're going to make sure that we're not losing blood. So that's stage one, and that's pretty quick. That's going to happen within minutes of this being sensed, and it's going to go on for probably about 36 hours. Step two is cleanup. So you got to figure that if a cell bursts or fibers are torn, tendons, ligaments, any of those fibrous soft tissues, you're going to need to clean up that debris. So the white blood cells are coming to that area to clean up and get rid of any cells that are injured. So say that we got a cell that didn't quite get destroyed in this mechanical, thermal, or chemical trauma that happened. That cell is kind of hanging on a thread and it's not doing well. Those white blood cells will actually get rid of those cells. So again, when I said the NSAIDs, when we start having arachidonic acid levels elevate from blocking it, those cells could be part of what the white blood cell's dealing with, okay? So step 2 is cleanup. Step 3, repair. That's when everything has been broken down that was not working and all the loose ends are sitting there. Now we're going to want to start cleaning up or repairing that area, I'm sorry. So the amazing part is platelets. So that clot that formed, those platelets actually carry all these different chemicals to induce the healing response. Platelets do not have nucleuses. They do not have DNA within them. They can't make proteins on the go. So all those platelets are carrying a package, basically, almost like an emergency. Hey, here's the instructions. So after that cleanup process is done, those clots are going to start, those platelets are going to start releasing all those different things that are going to stimulate mitosis, cell division, getting those cells to grow and repair that area, telling fibroblasts to start producing different proteins to refix that network. So this also explains why PRP is affected. PRP is that platelet-rich protein therapy that's done where they extract your blood, extract those platelets, and if you got a chronic injury, they're going to inject them in there. They're basically trying to get that whole process of repair restarted. So within this process, there's 2 outcomes. Complete recovery. So that's when you have an acute injury, you have that phase where you're hurting, you're swelling, you're repairing, and then it's resolved. The topic of this discussion is more about what happens when this doesn't resolve itself. What happens when we get to that chronic cycle? Well, chronic cycle is poorly understood. I started actually producing this video today because a friend asked me about an article that she read related to NSAIDs, non-steroidal anti-inflammatories, or even steroids, corticosteroids, actually being detrimental. So if someone has acute injury and they resort to using these pharmaceuticals, you're actually increasing your risk of chronicity of the injury. So kind of interesting. So chronic pain and swelling, the reason that it's still occurring is debris. So this whole situation right here is still going on. We're still getting that signal to release the arachidonic acid. We're still getting those prostaglandins. They're not at that peak level they were during the acute reaction, but they're at that low level. They're just constantly nagging that situation. And that reminds me, I'm sorry, I skipped one part of prostaglandins, probably the most important part. So when we have debris in the area, we have free nerve endings. Those free nerve endings are also going to sense this just as that receptor is going to sense it. That free nerve ending is going to be sending that pain signal up. When the prostaglandins get released, they actually increase the nerve firing rate. They actually sensitize those nerves so that they're more perceptive of that debris. With nerves, the increased firing rate equates to increased perceived perception of the pain. So those prostaglandins are sensitizing these. This gets important because when I said debris continues, these nerves are still firing. And they're actually firing at a sensitized rate. So they might be telling the brain that there's actually more of a problem that's occurring in that area than actually is when you're in a chronic situation. So think of everything about chronicity as debris. Now what's going to cause that debris to continue? Well, the most common thing I see in my practice, and the major reason I believe, not that NSAID use is the major reason, but I believe that repetitive use. When people get injured, they're usually getting injured doing something they have to do every day. It's at work, it's a posture. So overusing it during this repair phase, it's going to keep on causing, how should I say, incomplete repair. So as fibers are trying to grow and they're linking up and they're cross-linking and forming a scar, if you keep on breaking them down, they don't get the chance to completely heal themselves. Stress in the area is an important thing too. What I mean by that, this is where obesity comes in. If you've got excessive weight and it's just a high demand, say on your joints that are trying to repair a ligament or a tendon, that obesity is going to prolong this process too and cause breakdown of those healing fibers and continued debris in the area. The other part is underuse. If you're going through this phase and you completely immobilize this, it's not a good situation. During this repair process, Wolff's Law is how fibrous tissue repairs. And what I mean by Wolff's Law is Wolff's Law says that tissues will develop, soft tissue, fibrous tissues will heal based on the stress lines. So if you're not getting any stress line, you're not inducing this fibrous deposit of tendons and ligaments. So not enough activity isn't good. The other part of that is if you're not getting enough activity, when you're healing a fibrous injury, it's just like a scab on your skin. Those fibers aren't just orienting within Wolff's Law. They're orienting in every direction. They're predominantly orienting where the stress lines are. But if you start getting all these fibers that are all over the place, you're going to get scar tissue formation, which with scar tissue formation, then you got the chronic, as you're using it, it's breaking those tissues that are not necessary, increasing debris again. So inactivity during your healing process could create chronicity in the long run. So the other thing, these are the extras in there. Low antioxidant levels in your diet, huge. How are we getting rid of this debris and free radicals? You're neutralizing them. So dietary antioxidants are going to be beneficial. Diet's low in omega-6 fatty acids. If you don't have a lot of arachidonic acid in those cell membranes and you're needing those to create this prostaglandin healing response, you're not going to heal as fast. You're not going to heal as complete, I should say. This prostaglandin level will be too low. Higher order pain perception or autonomic dysfunction. What I mean by that, when I was talking earlier about how sensitizing those nerves is going to make it so maybe you're feeling something that's more painful than the actual trauma that's in the area. Well, it can go the other way. Even if that nerve fiber is sending a little higher than normal amount of pain reception, if it's perceived differently in the brain, it's going to be at a higher level. That's where opioids come in. Opioids are trying to block those receptors up in the higher order centers, but obviously if you've ever taken an opiate, they're not very effective at blocking that. So the other part is autonomic dysfunction. I'm not going to get into that heavily, but when this whole process occurs, there's actually a neurologic reaction to the area too, to prevent bleeding, to just aid in this process. Sometimes that autonomic dysfunction can overreact and then not stop when it should. They've changed the name so many times, I'm stuttering on it. Complex regional pain syndrome is an autonomic dysfunction. So it also gets into what I talk about with the quantum system. If that system isn't sending out that message of how to activate stem cells in the area, how to replace those fibers in the right direction, there's instructions of how to repair that. That's also going through that autonomic system through the quantum. So that's one part of where I help with the cold laser therapy, getting that energy to that area, those frequencies at the proper tune. I didn't mention here either on the higher order thing, anxiety and depression greatly affect your perception of pain. So again, another thing that could relate to the chronic nature of the pain. NSAIDs and steroids, I kind of touched on it already a little bit. They decrease your prostaglandin production. So they're decreasing all of these different reactions to the healing process. Side effects of the NSAIDs. I was quite surprised about this. This COX enzyme, it's not just used for producing those prostaglandins. Those COX enzymes also function to maintain your GI integrity, to keep that mucous membrane, thick and healthy like it should. That's why people taking NSAIDs have trouble with stomach ulcers and all these different, you hear Crohn's disease and all these different things. It's overuse of these NSAIDs for the most part. Maintains renal flow. I was surprised when I learned this, that the COX enzyme is actually monitoring dilation of the blood vessels going to the kidney. Ovarian uterine contractions during labor and menstruation and ovulation. Again, pretty surprised about that. How many people are having their period and they're throwing the NSAIDs down? It's actually negatively affecting how your body is eliminating that endometrial layer. Blood clotting, we already talked about. Those COX enzymes are vital in the central nervous system. They don't quite understand this yet. The reading I did was even linking it to different things like degenerative diseases like Parkinson's and Alzheimer's. So interesting, they're still researching that. Yeah, there's probably even more things that COX enzyme is doing, and it gets to that whole concept of conventional medicine, the flaw of the model of looking at everything as chemical reactions and trying to find things that interact with enzymes and stop reactions. They have the magic bullet theory. Well, it'd be great if we had a magic bullet that just slowed this process down to decrease pain. But the problem is there's no such thing as a magic bullet. Once you start messing with one enzyme in one place, it's messing with them in other places, hence side effects. So NSAIDs I talked about earlier are going to increase that arachidonic acid concentration in healthy cells and cause more healthy cells to die, creating more debris. Less pain, too much movement. I think this is an interesting one because up here I was talking about the repetitive use. So if people are taking these NSAIDs or getting a corticosteroid shot, they're not feeling the pain like they should. So these things are still trying to occur. The cleanup and repair is supposed to be happening, but if you're overdoing it, you're damaging that repair and you're creating more debris. So interesting angle to look at. So in short, the NSAIDs aren't good. The short-term relief, long-term risk of chronic pain, it's not worth the risk. And I'm going to discuss that in a minute here. So I'm going to erase my board and I'm going to rewrite up some stuff here about what we should be doing. Okay, what should we be doing? Well, immediately after acute injury, ice rest, good 36 hours. You want to just take it easy, let that whole prostaglandin response start its process. Use prescriptions wisely. When I'm giving this talk, I'm not saying never use an NSAID, never use a corticosteroid. I think it's the abuse of it. It's the taking them every day, multiple times during an injury. So if you have an injury and you're at home and the ice and rest is not doing it, and you're sitting there in severe pain, take a dose of the NSAIDs. It's not going to be the end of the world. It's not like every one of these COX enzymes is going to be inhibited. It's going to lighten the burden a little bit of excessive reaction to it. What I mean by that is you might knock out that pain signal a little bit. That's all you're looking for with it. Corticosteroids, I wouldn't jump into that ever in an acute injury. If you're in a chronic state and you've done everything that you can conservatively and you're just not getting relief, going into a situation with a corticosteroid and a PRP plan would probably be an option if everything else is failing. So prescriptions are not off the table, wisely. Good health. So prior to this injury, you want to have a strong system. You want to be eating a good diet that's high in antioxidants, high in omega fats. You want a healthy gut, decrease your toxic burden, decrease the amount of radicals in your system, decrease the stress on your immune system so it can respond when it needs to respond. Avoid excessive calorie intake. This is kind of common sense. I'm not saying it just for obesity and carrying too much weight, but when you're increasing the amount of calories through sugar, processed oils, even good oils, your body's going to be processing a ton of activity and it's going to be making free radicals with it. So just not consuming more energy than you need is basically what I'm getting at. So it's going to increase your radical production, increase your weight, which that's just going to be a stress. Exercise. Trauma is good. When we go through this inflammatory process, it's a natural process. When it works like it's supposed to, it actually gets stronger. Your system is more efficient at taking care of these. These nerves and the autonomic system are going to be able to cope with that pain at a better, healthier way than it would if it's a very rare event that you feel discomfort. So exercise trauma is not a bad thing. Exercise is going to strengthen your soft tissues. When I was talking about Wolff's Law a minute ago, when those fibers are growing based on stress, your body is going to be stronger and be less likely to suffer a mechanical injury if it's being used like it should be. That also goes along with joints. When your muscles aren't very strong from activity, you have less stability in your joints. So you do your thing where you're walking in the park one day and you hit an unlevel surface, you're not strong to respond. You're more likely to get injured. So these are the good health habits that you should be doing anyway, just for everything. It's cancer prevention, cardiovascular health. When you're in the situation where you first get that acute injury, things you can do to help it is going to be turmeric and ginger. Those are great antioxidants. Again, they're going to help clean up that debris. Green tea, same thing, good antioxidant. Berries, anything with skin. When you're consuming fruits, your antioxidants are going to be in the skin of the fruit. They're not going to be in that pulp center. That's going to be where the sugar, fiber, and water is. So you want to consume any type of fruit with a skin on it. Berries are the number one out there. They're the highest in antioxidants. Pomegranates on that list. Vegetables, root vegetables, carrots, cruciferous, broccoli, you name it. Anything that's green is going to be very good for you for antioxidants. So water, another part I didn't bring up in this topic earlier, but when we were talking about dilution, if you're dehydrated, you're not going to be able to dilute that area as good. So staying hydrated is going to help that initial response, And then that recovery phase, your body eventually is going to be sweeping out that fluid. So if you're dehydrated, you're not going to receive that swelling like you should. So I hope these were all good tips. I think at this point, it's another one of those videos that if you followed me, you probably understand more about inflammation than any of the doctors you're going to that are trying to put you on the NSAIDs or the corticosteroids. So I hope you enjoyed this, and I look forward to our next video.